Welcome back to Mind Matters with Dr. Ogochukwu Ojiako. Last time we discussed prejudice and discrimination around mental illness and how we can fight stigma and support individuals with mental illness. If you have not watched the last video already, please endeavor to do so in order to stay up to date. Today we'll be discussing anxiety disorders. This is going to have multiple series. Anxiety disorders are among the most common of all psychiatric illnesses. It is a mental health diagnosis that is characterized by feelings of worry, apprehension, and intense fear that are strong enough to interrupt one's daily activities. I wanted to discuss anxiety today because many people are unaware that anxiety can actually be a mental health disorder that requires professional intervention. Of course, anxiety is a normal human emotion. However, there are different levels of anxiety. There is mild level, moderate, severe levels, and then there is panic disorder. The mild and the moderate levels of anxiety are normal. Actually, these two levels can be motivational. For instance, if you have an upcoming exam, this is the type of anxiety that motivates one to study harder in order to be successful on the exam. In the mild level of anxiety, vital signs are normal. However, there is often increased awareness of one's surroundings. In the moderate level of anxiety, there is mild increase in heart rate, moderate increase in muscle tone, subjective feeling of worry or apprehension, and narrowed perception. Then we have severe level of anxiety and panic disorder. These two levels are considered pathological, which means that they are abnormal. The severe level of anxiety causes the pupils to dilate. It causes diaphoresis, increased muscle rigidity, causes urinary frequency, diarrhea, and sweating profusely. The panic disorder, on the other hand, causes significantly increased symptoms. However, today we'll be focusing on the mild, the moderate, and the severe levels of anxiety. In our future series, we will address the different types of anxieties, which will include panic disorder. Anxiety is considered pathological when it is disproportionate to event, when it is sustained over a long period of time, when it impairs one's function, and when it is clearly unrelated to any identifiable event or situation in a person's life. This type of anxiety interferes with perception, memory, judgment, and motor responses. So, they require professional treatment and therapeutic intervention. Initially, anxiety presents as several physical illness states. People experiencing anxiety may complain of chest pain, palpitation, sweating, and even feel as if they are about to have a heart attack. Of course, we want to make sure that the individual gets proper workup to rule out cardiac-related issues or other possible causes of their symptoms. Often, anxiety is diagnosed or correctly identified after several unnecessary assessments and diagnostic evaluations. This is due to the high level of somatic symptoms of anxiety disorder. Research has shown that untreated high levels of anxiety predisposes people to other serious health problems. With that said, the first step to seeking treatment is to talk to your medical provider to make sure that your symptoms are not due to other physical problems. Of course, if anxiety is diagnosed, a mental health professional can work with you to design the best treatment plan for you. Sadly, many people with anxiety disorder do not seek treatment because they are unaware that anxiety is treatable. As stated earlier, anxiety is among the most common of all psychiatric illnesses. It is distinguished by the degree of anxiety experienced by the client, the duration of the anxiety, the severity of anxiety, and the behavior manifestations seen in the client experiencing the anxiety. It is very important to know that anxiety ranges from acute state to chronic disorders, and they are often associated with physical symptoms such as chest pain, chest tightness, weakness, and shortness of breath. In the future, we will explore the different types of anxieties that exist, which will include panic disorder, agoraphobia, specific phobia, social anxiety, and generalized anxiety disorder. If you or someone you know is experiencing a medical or mental health emergency, please call 911. You can also call the crisis line number 866 903 3787, or you can go to the nearest emergency room for treatment. Our email address is located in the description. Please feel free to send us your general questions. We will randomly select questions to be addressed in our future videos. Please like, comment, subscribe, and share this video with your friends and your families. Thank you for watching. I am Dr. Ogochukwu Ojiako. Thank you.